This educational video will explain the implantation of a bio-ring adjustable gastric band and how weight loss occurs after the procedure. It will show how the bio-ring adjustable gastric band is sutured into place to prevent it from slipping. Finally, it will demonstrate how and why an infuser port is sutured to the abdominal wall below the subcutaneous layer underneath the skin. The operation is performed laparoscopically. This means the surgeon will place a series of trocars through the abdominal wall to gain access to the stomach. By using laparoscopic instruments, the surgeon will insert the bio-ring adjustable gastric band through a trocar into the abdominal cavity. Once inside the abdominal cavity, the surgeon will then create a retrogastric tunnel. The gastric band will then be passed through this retrogastric tunnel and placed around the stomach. The gastric band is positioned around the stomach just below where the esophagus connects to the stomach. This part of the stomach is known as the gastric pouch and holds 1 to 2 ounces of food. Your surgeon will then lock the band into position by threading one end of the tube through the buckle on the other end of the band. The surgeon will then stitch the part of the stomach that is directly below the band to the part of the stomach that is directly above the band. These permanent sutures will help keep the band in position and prevent it from slipping. The next step in the procedure will be to remove the tubing through one of the trocars. The trocars are then removed and the tubing is connected to an infuser port. The infuser port is sutured to the muscle layer underneath the skin and kept in position by using permanent sutures. The port allows your surgeon to adjust the amount of saline that is in the band in order to adjust the constriction of the gastric band around the stomach. This will help the surgeon achieve the optimal degree of restriction to suit your individual needs. The optimal amount of restriction is usually achieved after a few adjustments. You can see in this demonstration how adding saline increases the restriction of the gastric band. Weight loss occurs because the pouch above the band fills up after only having a small amount of food, giving you the feeling of satiety.